to log on, so bear with me. Are you ready? Good afternoon, everybody. We're going to go ahead and get started here. And we're just going to ask Dr. O if you could turn on your camera for us. Joining us this afternoon is Mayor Margot and also Dr. Carranza for today's press conference. Mayor, if I can ask you to go ahead and unmute yourself, and I'm going to have you start us off.
Okay. Everybody hear me?
Yes, sir.
All right. Thank you for joining us this afternoon. I'm going to begin this on a very somber note. We just received word within the last hour that our first COVID-related death has occurred. Dr. Carranza will expand more, but this is a male in his 80s who passed away in one of our hospitals. We're also up to 225 positive cases reported thus far, and again, Dr. Carranza will expand. You know, although Easter weekend is typically a time for our families to come together, we must continue to stay home and maintain social distancing during this time of celebration. I want to remind the public that in order to protect family and friends from this highly contagious COVID-19 virus, gatherings and picnicking at city or state parks during Easter weekend is not allowed. This includes city-owned hike and bike trails, playgrounds, basketball courts, dog parks, and skate parks until further notice. The Parks and Recreation Department has received numerous complaints of people parking outside of McElligott Canyon and using the road to walk, run, or cycle. The use of McElligott Canyon by the public remains prohibited. In addition, at-home gatherings or parties or other group activities are not permitted. This includes the gathering of family members who do not live in the home. We've had 2 incidents of these types of gatherings in the last week, in which there was a group of 20-year-olds and a group of 40-year-olds. And in one group, 5 were positive cases, and then the other 7 were positive cases. While all parks and playgrounds are closed, you can still walk and bike around your neighborhood, but maintain a distance of at least 6 feet. You could spread COVID-19 to others even if you don't feel sick. Everyone should wear a cloth face cover when they have to go out in public, for example, to the grocery store or to pick up any necessities. The cloth face cover is meant to protect other people in case you are affected or asymptomatic. We have posted information on how to make your own face cover on social media, and you can look at the epstrong.org website for help. A mask is not a substitute for social distancing. Continue to keep 6 feet between yourself and others. As the number of cases in El Paso continues to increase daily, the city is prepared to respond to every challenge we face with the spread of the virus. I would like to stress to the public that compliance to the stay-home order is critical to the public health and safety of this community. I want to once again remind everyone, gatherings will continue the community spread of this virus. So please do not gather for family parties, dinners, or lunches with individuals who don't live in your home. We are all adjusting to social distancing in a community where Sunday gathering is a tradition. I encourage our community to video chat this Easter Sunday. And I know we have a lot that travel to Juarez on a weekend, on Sundays especially, to visit with family. I just received word that there will be no Mass in Juarez this Sunday. Please be very careful. Please avoid those gatherings, or schedule calls with your family and friends so that we can all feel united during this time. We will overcome this challenge as a community, and we must all do our part to keep our families and neighbors safe from the spread of the virus. The sooner we suppress the spread, the sooner we can start getting back to normal. Thank you to all of you who have stayed home. You are making a difference in how we suppress the spread of this virus. I would like to thank all those essential workers, first responders, and to all of the doctors and nurses working daily on the front lines of this pandemic. We are truly grateful. And as a symbol of that gratefulness, on every Friday from now on through this pandemic here in El Paso, we would like everyone to turn their lights on at 7:30 in the evening to honor our first responders and our physicians. Let's continue to do what we can do for our community. This morning, there was a line outside of our food bank that stretched for over a mile, an hour and a half before it opened. We have a lot of needs in this community. I ask you to dig deep for our food bank. Check with the Paso del Norte Foundation on their website for opportunities, the El Paso Community Foundation for other opportunities. It's a time for all of us to come together to stop this pandemic once and for all, to suppress the spread of the virus, and to gather together as a community and get back to normal as soon as we can. Now I'll turn it over to Dr. Ocarranza.
Thank you, Mayor. And with a heavy heart, we would like to report the first death in our community due to the COVID-19. Our thoughts and prayers go out to the family. And this was a male patient in his 80s with an extensive list of pre-existing medical conditions. We feel very sad that we have this death in our community, and we will continue being vigilant as how the virus behaves in our community. As Mayor Margo says, we have a total of 225 positive cases of COVID-19, 107 males, 118 females, and there's been testing done through the drive-through and also through some private providers that we have been trying to collect all that information, and we have an approximate number, 3,500 tests that have been done in El Paso. We have, through our epidemiological investigations, we have few clusters where one was a gathering attendees in their 20s, another gathering of attendees in their 40s, where in the first gathering have 5 positive cases, second gathering has 7 positive cases, and we have another investigation going in a healthcare facility which has already 11 positive cases. And the distribution and all those positive cases that we have in El Paso, we see that approximately 60% of the people are under the age of 40s. So it is extremely, extremely important that we continue observing the social distancing. That is what is going to help us get through this pandemic. And we urge all the community members to observe the stay-at-home order. This is extremely important, and on Easter Sunday, we used to all gather, celebrate but we can do it in a virtual way. Please, if you have no essential traveling, don't do it outside of El Paso, either to other states, either to Juarez, to visit family. That is not going to be considered essential traveling, so please refrain from doing that. We are seeing a lot more positive cases of the COVID-19, and it's in all of our community that includes El Paso, Ciudad Juarez, and Las Cruces. So be mindful, and as we will continue reminding you, washing your hands often, don't touch your face, observe social distancing, choose only one person in the household to go out and do the essential activities like grocery shopping. Please keep our loved ones, especially those vulnerable ones, at home. Don't let them go outside with you to perform those essential activities. And please do not gather. This is extremely important. One of the other things that we want to keep telling the community, that the use of face masks, it is one of the other tools that we have to prevent the spread of the virus between each other. So we all need to protect each other. We all need to wear our face masks. We all need to stay at home. Thank you.
Doctor, si nos puede dar la traducción en español, por favor.
Claro que sí. Con mucho sentimiento y tristeza les queremos informar a nuestra comunidad que tenemos la primera defunción debido al COVID-19 y nuestro pésame a toda la familia de este paciente, que es un masculino en sus 80 años que tenía una larga historia de padecimientos médicos. Queremos informarle a la comunidad que seguimos vigilando cómo se comporta el virus en nuestra comunidad y hasta el momento tenemos positivos 225 personas, de las cuales 107 son hombres, 118 son mujeres. Pero lo que es bien importante recalcar es que el 60% de todos estos positivos son personas menores de 40 años. So, por favor, haga caso de todas las órdenes que hemos dado, de todas las indicaciones, porque estas personas jóvenes son las que pueden estar transmitiendo el virus, inclusive aunque no tengan síntomas. Entonces hay que obedecer la orden de estarse en la casa, de lavarse seguido las manos, no tocarse la cara, y sobre todo en este domingo de Pascua, que todo el mundo acostumbra a juntarse, de festejar, de celebrar. Hay que hacerlo, pero de una manera virtual. No vaya a visitar a ningún familiar, no visite a nadie, no haga fiestas, porque eso es lo que va a causar muchos más problemas y va a causar mucho más esparción del virus en todos nuestros seres queridos, y aquellos que son los más vulnerables son los que van a sufrir las complicaciones más severas. Les pedimos por favor que no hagan viajes innecesarios a Juárez, a algún otro estado, a ningún otro lugar. Quédese en la casa. Eso es el arma que tenemos más importante para combatir la transmisión del virus y poder salir de esto mucho más rápido. Aparte del distanciamiento social y el quedarse en la casa, si va a tener que salir, escoja una sola persona de la familia que va a hacer todo este tipo de actividades y no lleve a toda la familia a hacer las compras de mandado, a salir de la casa. Eso lo único que va a propiciar es de que todos en la casa se contagien y va a crear un problema mucho más grande. El virus se puede contagiar de persona a persona y hay que protegernos unos a otros. Es responsabilidad de todos combatir esto, y aparte del distanciamiento social y aparte de quedarnos en la casa, el uso de las mascarillas es bien importante para prevenir la transmisión de persona a persona. Entonces hay que cuidarnos unos a otros para poder salir adelante.
Gracias, doctor. La primera pregunta que tenemos en español. Sabemos que dentro de las personas contagiadas por el coronavirus se encuentran por lo menos 3 menores de edad. ¿Qué recomendaciones tiene para los padres de familias que encuentran preocupación sobre la situación?
La mejor recomendación que tenemos para prevenir la transmisión del virus a nuestros menores es el que, no los lleve a todos sus hijos a hacer las compras. Hemos estado viendo que familias enteras salen, familias enteras están en estos lugares públicos y ahí es donde puede acabar alguno de ellos contagiado. Si alguno de los adultos se contagia, es más común que pueda contagiarle a todos los miembros de su familia. Entonces, si eso pasa, quédense todos en la casa. Si uno de la familia está enfermo, considere que todos están enfermos y todos quédense en su casa. No porque alguien no tenga síntomas, no quiere decir que pueda contagiar a otro. Y hay que enseñar a nuestros menores de edad a lavarnos las manos seguido, a no tocarnos la cara, a que se pongan su máscara y a que tengan ese distanciamiento social. El dejarlos todos en la casa es lo que más nos va a proteger. And now in English, the question was, there are some minor that came back positive for COVID-19, and what can we do to protect them against the disease? And our best recommendation is to tell families not to be going out together. Choose only one person to come out of the house to do the essential shopping, like groceries, etc., because we have seen whole families going to buy the groceries or the necessary supplies. Please refrain from doing that. It is extremely important that we keep everybody home and choose only one person that is going to go out and do that for the whole family. And if in the case one of the family members becomes sick, consider the whole family to be sick and don't be out, because that can spread the virus even further. Please teach our kids, all the younger ones, to wash their hands often, to observe the social distancing, and also for everybody to be wearing the mask. We appreciate it for those that remain at home and follow the orders, and for those that feel that this is not something that is appropriate, we encourage you and we would love to strongly invite you to follow the orders.
Gracias, doctor. La siguiente pregunta. ¿Cuáles son los tratamientos disponibles en el condado de El Paso para tratar el virus? No sé si ustedes saben esa.
Bueno, el tratamiento para combatir el virus, no hay un tratamiento en específico que se haya comprobado que funcione más que otros. Se están haciendo tratamientos experimentales en gente que está enferma y hay unos antivirales, hay otros que son una medicina que combate la malaria, que también se está usando con éxito, pero los médicos tratantes de todos los pacientes con COVID-19 son los más indicados en dar la mejor recomendación para sus pacientes, con el hecho de que se recuperen de una manera más rápida y más efectiva. And now in English, what are the available treatments that we have for COVID-19 in our community? And the best treatment for the patient is going to be recommended by the attending physician who's treating your loved one against COVID-19. We know that there's some experimental medications that have been used with success around the world, and one of them includes an antiviral. Some other one is an antimalarial medication that has been mentioned that works well. And again, the attending physician who's caring for those loved ones affected by the COVID-19 are going to be the ones giving the best recommendation for those patients to promote a faster recovery.
Thank you, doctor. The next question. Was the man who passed away from the virus tested post-mortem? I'm not sure if you know that answer, doctor.
I don't know that answer, but a lot of other particulars about this case is under investigation still, and I have not much more information about that. Y en español, ahorita no tengo la información si la prueba del COVID-19 se realizó post-mortem o no, pero estamos haciendo las investigaciones para tener muchos más detalles acerca de este caso en particular.
Gracias, doctor. The next question. Forgive me. What is your thoughts with regard to the sudden surge in COVID-19 deaths, particularly in Juarez? As of this morning, there are 10, and Governor Corral has said that there's a glitch in the coordination with the federal hospitals in Mexico, but that is quite a few people. What are your thoughts?
Well, we're a community, and we have seen a surge in positive cases of COVID-19, and we believe that our neighbors in the south are not an exception. We are closely monitoring the situation in regards to the cases, but also in regards to the deaths that have been happening in Juarez, and we are extremely concerned about that situation. And the best tool that we have is one, we're hoping that our message about social distancing, about staying at home, can spread far beyond the border into Juarez, and the people start listening to do that, and that's the best weapon and the best tool that we have against COVID-19. We know that a lot of us have families and have strong ties with Juarez, so we recommend and we strongly advise against you go and visit your relatives. If you don't need to go, do not go. That's going to be the best thing, because we can bring things from El Paso to Juarez the same way that from Juarez to El Paso, and one of the things is this virus. So we need to stop the spread of the virus by everybody staying home. Y ahora en español, estamos monitoreando la situación muy de cerca en cuanto a Juárez, y sabemos que la cantidad de casos positivos en El Paso es un reflejo de lo que está pasando en toda nuestra comunidad, y no va a ser una excepción el ver una cantidad enorme de casos en Ciudad Juárez. Y también estamos monitoreando muy de cerca la cantidad de defunciones que están teniendo nuestros vecinos del sur. Sabemos que muchas personas tenemos familiares, tenemos seres queridos en los dos lados de la frontera, y por eso les pedimos y les recomendamos muy insistentemente que no visiten a todos esos seres queridos, porque el tránsito de personas de un lado al otro es lo que va a propiciar que el virus se desparrame más fácil, y ya sea que nosotros llevamos el virus o que alguien se los traiga, y va a afectar a cada uno de nuestros hogares, en nuestros seres queridos, sobre todo los más vulnerables. Lo hemos repetido una y muchas veces esto, pero esperamos que nuestro mensaje y nuestra mejor herramienta que tenemos para combatir el virus, que es el distanciamiento social, que es el estarse en la casa, el usar máscaras, pueda llegar muy lejos en Juárez, y que la gente empiece a seguir estas recomendaciones que tenemos, que no son exclusivamente para El Paso, sino son para toda la comunidad, porque todos nos tenemos que proteger unos a otros.
Gracias, doctor. The next question. When you report recovered cases, how is it determined that the patient has recovered and is able to go home?
Well, when we report recovered patients, it's not just the patients that recover from the hospital, but those are the patients that we release from isolation based on that they have already spent at least 14 days in isolation from the day that they started with symptoms, and that they have no symptoms. That's a recommendation for those people that have tested positive and that we have released from our isolation. So we don't talk about the recovery from the hospital, but it's the release from isolation that we consider that they are recovering in convalescent state. Y en español, lo que reportamos en cuanto a casos que se recuperaron o que se aliviaron, no significa nada más los pacientes que estaban en el hospital, sino a los pacientes que ya hemos liberado de aislamiento por la razón de que tuvieron positivo el virus del COVID-19 y que tenían síntomas. Estos pacientes los dejamos en aislamiento por lo menos 14 días y tienen que haberse recuperado de sus síntomas para poder liberarlos del aislamiento.
Gracias, doctor. The next question. What tests do they need to pass before they are considered recovered? And how can their family or the public be assured that they are no longer contagious?
We're basing our recommendation on the time since they started with the symptoms, and we want for those people to have recovered from the symptoms, and also the time from the onset of the symptoms. We follow recommendations from the CDC guidelines, and the people that are at the same household, that's what we tell them, that if one person in the household is infected or is ill, we consider the whole household to be infected. So we recommend that all the household stays home and don't go out and do any activities, or even though it's essential. So if we all follow those recommendations, we will be in a better position. Y en español ahora, nosotros en el Departamento de Salud seguimos la guía que nos marca el Centro de Control de Enfermedades, en el cual nos guiamos por el número de días de que se iniciaron los síntomas y lo liberamos del aislamiento cuando se han recuperado de los síntomas y han pasado por lo menos 14 días. Cuando una persona de la casa está infectada, todos los de esa casa deben de considerar que están expuestos y están infectados. Entonces, no salgan a hacer ninguna actividad aunque sea esencial, porque eso va a ocasionar mucho más transmisión del virus alrededor de otras personas y alrededor de nuestra comunidad. Entonces, si una persona está enferma de la casa, toda la casa tenemos que quedarnos en la casa.
Gracias, doctor. The city of El Paso has said people should self-quarantine for 14 days if they travel 100 miles outside of El Paso. The CDC also recommends that if you travel internationally, you should self-quarantine for 14 days. And you recently mentioned at the last press conference that Juarez is not as strict as El Paso. Should people who go over into Juarez and come back self-quarantine if you're wanting to follow the CDC guidelines?
Well, it is a very particular situation that we have here in El Paso because it's a binational community. We're considered a single community. The difference is that we're divided by a border. What the CDC means is for those people that are in the continental U.S., if they're traveling internationally, they have to go through extensive traveling to go somewhere else. But our recommendations here in El Paso, yes, they're stricter, and we hope that our message goes and reaches farther into Juarez, where our strong bonds and family members and connections are still there, and hoping that they can follow the same. So we're definitely recommending that people observe that even if they're in Juarez. So if we have people coming from Juarez, for example, to visit us, we need to tell them not to come and visit us. And in the same token, we are strongly advising every resident in our community not to go visit any other relatives, whether it's here in Juarez. So the same recommendation applies. So we appreciate.
But let me clarify.
Yes.
Let me clarify. Dr. Carranza is correct. We view Juarez and southern New Mexico as part of our one region for public health. But those that are going back and forth for employment at the Maquilas and elsewhere, no, we understand. In most cases, they're part of an essential workforce. They don't have to quarantine, but they need to maintain the social distancing, wear the masks, and do those things. But no, not each time you go over there and come back, you don't have to quarantine for 14 days. But those who've traveled from the interior and come through Juarez, we do recommend that. But the main thing is, we just had our first death. We were frankly surprised we haven't had one sooner. But the only way we're going to suppress this and stop those from happening is to maintain the social distancing, the hand washing, the wearing of face masks, and stop the gatherings, family or otherwise.
Thank you, Mayor. Dr. O, would you be able to expand in Spanish?
Yes, la pregunta era de por qué, si el CDC recomienda y nuestras órdenes recomendamos que si viaja más de 100 millas se pongan en cuarentena voluntaria, y el CDC recomienda que si también viajaron internacionalmente se pongan en cuarentena voluntaria. Lo que explicamos es de que nuestra comunidad está compuesta por Ciudad Juárez, El Paso y Las Cruces, el cual tenemos mucho tráfico de gente que trabaja en Ciudad Juárez o trabajan en El Paso, y esta gente no se va a poner en cuarentena, pero la cuarentena aplica cuando viajan mucho más al interior o que viajan a algún otro viaje que no es esencial y en el cual regresan a nuestra comunidad. Queremos hacerle hincapié a toda la gente que no visite a sus familiares en Juárez, que los gentes que están en Juárez no visiten a sus familiares en El Paso, porque eso es lo que va a traer muchos más problemas, y esa es la esencia de toda la orden que hemos dado, y en la cual tenemos que quedarnos en nuestra casa y observar el distanciamiento social, observar la orden que se dimos de estar en casa para poder combatir esto de una mejor manera.
Gracias, doctor. The next question, what COVID-19 projection models is the city or the county using to look at in order to make their policy decisions? And doctor, I don't know if you might be able to expand on that.
Well, we look at different modelings, and what we're trying to determine also is if we have a number that is statistically significant to make some more accurate inferences as how the virus is affecting us. But there's several modelings out there where the White House uses one, the state of Texas uses another one. There's some of the bigger models use a statewide modeling, and they don't focus much on the narrowing to city-specific modeling. But more information can be provided.
One of the modelings that we got was from the Dell Medical School in Austin that's been used across the state. They did a mathematical modeling on suppression and social distancing for the top 22 cities in Texas. They did Dallas-Fort Worth as one region. Basically what their model says, and everything is, I don't want to call it subjective, but it's not finalized, is that we are probably about 2 weeks from our peak. And I hope that is correct. And then we can see where we are within the next 4 weeks and maybe start getting back to normal as soon as possible. But we don't know that yet. So every day there's more information that Dr. Carranza, the Public Health Department, receives. Sometimes we receive it at the city, but it's hypothetical right now.
Thank you, Mayor. The next question. With regard to the individual who was reported as having died from COVID, was this case community spread or did it come from outside of El Paso?
We're still gathering a little more information in regards to the case to be able to establish whether it's a community spread. But as we gather more information, we can definitely communicate some of that.
Y si me lo puede dar en español, por favor.
Claro. La pregunta era si en el momento sabemos si el paciente que falleció por COVID-19 adquirió el virus de una manera de transmisión comunitaria o fue que viajó, y hasta el momento seguimos haciendo toda la investigación pertinente, y cuando tengamos más información podemos informar un poquito más de acuerdo a esto. No ahorita en la actualidad todavía no tengo esa información disponible.
Gracias, doctor. The next question, have you identified cluster of cases in businesses? If so, where, and can you at least provide the type of industry if that is the case?
Well, we're looking at the positive cases, and we know that we had 2 cluster of cases that were related to gatherings, and we know that we have one in a healthcare facility that we're investigating, but we're looking at all the cases and trying to establish a relationship.
Y si me lo puede dar en español.
En español ya identificamos 3 brotes que 2 de ellos se debieron a reuniones y uno en una institución de salud, pero cada caso lo seguimos investigando y tratando de encontrar alguna relación entre estos casos para poder identificar más brotes y si hay algunos otros elementos particulares de cada caso.
Gracias, doctor. What is the proper procedure for decontamination of a facility once an employee has tested positive? Is the city inspecting if it's done properly? And I don't know if that can be answered by Jorge.
Hold on a second. I turned the camera off. We need to turn there.
Good afternoon. So there are CDC guidelines that provide some workplace guidance on disinfection, but really most of the items that we already have at hand, Clorox wipes, where you can wipe down surfaces, it's pretty much the standard method of disinfection of surfaces wherever that individual worked at primarily. But common areas like door handles, light switches, those are all areas of focus, especially particularly items that are touched frequently by various people.
Thank you, Jorge. The next question. Is the city already starting to work on an end game on how to slowly come out of the lockdown and bring people back into the workforce? And I believe this question might be for you, Mayor, if you might be able to answer this question for us.
Yes, we're already studying that. In 2 ways, the city is looking at its budget and what the losses will be expected for the balance of the year. And I'm forming an economic recovery task force. I've talked to Judge Samaniego, talked to our chambers, the Hispanic Chamber, the El Paso Chamber, different other groups, Progress 321, Borderplex, financial institutions, about gathering representatives so that we can start talking about what do we need to do as a community and what does the city need to do to help jumpstart the recovery once we can try to attempt to get back to normal once this pandemic is behind us. And it will be behind us. Whether it be a month or 2 months, the sooner the better. I understand that. This is, as I've said before, I look around and I see the lines at the food banks, and I understand in many cases people are feeling the cure is worse than the disease. But we've got to suppress this, and our only hope is we also want to avoid any more deaths if we can. And the only way we're going to do that is continuing to do the basic things related to social distancing and the wearing of masks and the washing of hands and all the basic things that are so simple to be done. But unfortunately, we're not doing them as expeditiously and as consistently as we need across this community as people report and they call 311 and say, I observed this and I observed that. So it's just critical. But yes, I'm going to form an economic recovery task force. We're going to figure out what we need to do as a community and move forward.
Thank you, Mayor. The next question, I believe it's for Dr. O. I don't know if you can, bring your camera back on. And Dr. O, I don't know if you can answer this question, but do we know when did the gentleman, the 80-year-old gentleman who passed away, did we know what time he or when he passed away?
Well, a lot of the particulars of this case cannot be disclosed based on privacy.
Thank you, doctor. Y si me lo puede dar en español, sí se sabe cuándo se murió el señor.
La hora en que falleció este paciente y muchas de las otras información en particular son cosas que no vamos a divulgar por razón de privacidad.
Gracias, doctor. Dr. O, you had mentioned that there have been 11 cases tied to a healthcare facility. Can you tell us the facility? If not, can you say what type of healthcare facility? If it was a hospital, assisted living, long-term care, for example, or is that also restricted?
That is also restricted, I'm sorry.
Gracias, doctor. The next question. If you give me a moment. ¿Cómo se están haciendo las pruebas de COVID-19 en las personas? ¿Existe un riesgo o evidencia de los alimentos importados de otros países afectados pueden transmitir el virus?
Esta parece que son dos preguntas en una y a contestar la primera parte de la pregunta en cuanto a si hay riesgo de cómo se realiza la prueba a los pacientes, sí hay riesgo para las personas que toman la muestra debido a que están manejando secreciones que contienen el virus y por la misma razón las personas que toman esas muestras tienen que aportar el equipo de protección personal necesario para evitar que se contagien. Ahora, la segunda parte de la pregunta, si una persona se puede contagiar de alimentos importados de regiones que estén afectadas por el virus, en eso no sabemos con exactitud qué tanto tiempo puede vivir el virus en ese tipo de productos, aunque se están haciendo mucha investigación al respecto, no tenemos esa información exacta. Now, in English, the question was about if there is a risk of contracting the virus while taking the sample of those patients, and the answer is yes, because the person collecting the sample needs to wear personal protective equipment or PPEs appropriately in order to avoid being infected by the virus at the time that they collect samples from patients. The second part of the question was if there is a known risk of transmission of the virus by foods that were imported from hotspots around the world. And there's a lot of research going on right now in regards to how long the virus can live in many items, but at this time we don't have the exact information whether it is or not.
Gracias, doctor. The next question. Should schools require all children to be present in the vehicles for the school lunches to be picked up? There appears to be conflicting messages by the schools and police officers. Is there a citywide policy as it relates to this? And I don't know if that's something that you or mayor can answer, or if it's a school district policy.
I'm not sure I followed what the question was, but I would have guessed this is school related. This is not the city policy. Our policies are pretty clear related to the basics that we talked about, the social distancing and what needs to be done on construction sites and those kinds of things. But I'm not sure I follow what the question is.
I would agree, Mayor. I think this is a question that the schools, a question
Okay,
for schools. The next question. How is self-quarantining if you travel more than 100 miles outside of the city being enforced? And I believe that question might be best answered by Jorge, if at all.
So there is, particularly working with the Department of Public Safety through our law enforcement partners, those that are coming through the airport, they are following strict quarantine measures that are issued by DPS to those individuals. They are required to maintain a 14-day quarantine, which is monitored by DPS. Now, the more challenging ones, of course, are the ones of individuals driving through state lines, and those are harder to ascertain. But those that are coming through our airport, we do have some strong enforcement there.
Thank you, sir. If you can stay on, because I believe the next question is best answered by Jorge Rodriguez. Dr. Ocarranza had mentioned that there's approximately 3,500 tests being conducted in El Paso. Does this estimated figure include the negative tests from private labs? Previously, only positive results from private labs have been reported. How did the city arrive to this number?
So the numbers reported by Dr. Ocarranza, we were able to communicate with not all of the private labs, but a few individual ones, and they did have significant numbers that were returned to us, and that does include all positive and negative cases in total.
And if I could ask Dr. Ocarranza if he could speak to that in Spanish.
El número que vimos de pruebas de 3,500 aproximadamente incluyen positivas y negativas que se realizaron.
Doctor, si puede prender la cámara.
En laboratorios privados, y todavía estamos esperando otras cifras de otros lugares que quedaron de respondernos en respecto a esto.
Gracias, doctor. The last question of the press conference: how many citations have been issued since the city and the county amended its orders on April 1st, and who has received them? And I don't believe that Jorge would have this off the top of his head, but if you could, Jorge, speak to that.
Yes, hold on a second.
Laura, we'll have to get back to you on that one particular question.
Thank you, sir. The last question for the press conference is a question for the mayor, and let me... Mayor, the question is, with regards to families, the request is not for families to go out and together for essential, and particularly for essential trips. So, do you believe that the schools should require that children should be present for the school lunches, or if it's recommended that they do anything different for the school districts?
Well, I'm not aware of the specifics on the school districts. What I've seen in the news and reported, when they were going for lunches, they were being handed out one at a time as people drove by. So I'm not aware of any gatherings, and I think the school districts are abiding by the social gathering limitations as well. But I really can't address that because I haven't seen that occurring. All I've been informed is that if they do drive-bys, are providing them with the meals. The big thing is, This is Holy Week. Tomorrow's Good Friday, and Sunday's Easter. It's a family time. It's a spiritual time. It's a time we can get together and think about our city and pray for our families and pray for our city. It's tough not celebrating like we would normally do. And that's one of the best things about our community is the fact that we are so family-oriented, multi-generationally family-oriented. But this is one time we've got to do it arm's length, 6 feet, do it by telephone, do it by video conferencing, do what you need to do, but just this one time recognize that this is critical in order for us to stop this pandemic in El Paso and to start getting back to normal the way we want to be, and to grow our community is to avoid the contact.
Thank you, Mayor. That concludes today's press conference. We thank everybody for their participation and have a safe evening.